everyone. Hope you and your families are staying safe and healthy. Welcome to today's webinar on the third wave and its possible effect on children. My name is Tom and I lead marketing at CMS IT Services. COVID-19 has made irreversible changes in our lives. The second wave has barely declined and there is a looming threat of the third wave. As we hear, it's most likely to affect children, the vulnerable group, as they are not vaccinated. We have with us today Dr. M. Ragavan, Head of Department, Pediatric Surgeon, Mayo International. In today's session, Dr. Ragavan will help us with some of these concerns by discussing the reality of the situation and how it can be handled to ensure it doesn't affect our loved ones. Over to you, Doctor.
Thank you so much, sir, for the introduction. And today I will be just sharing few slides about the present problem of this COVID-19, which is supposed to cause this third wave, and how it is going to affect our children. That is today's topic. So I will remove my mask also so that you can have a clear sound, since I am also alone here in the room. So dear executives and employees of this CMS company IT Services, welcome you all on board for this nice meeting to know something about this pandemic problem, the COVID-19. And let us go in this next half an hour about the problems what we face and how it is going to affect on our children. First of all, let us know what is meant by this coronavirus. See, it's a type of virus which commonly causes the respiratory tract infection. If we see worldwide, there are many viruses which will cause the common cold. Of these viruses, the coronavirus is the second commonest reason to cause common cold. So it is not a new virus. It is existing for many years and causing trouble to our human mankind. And it affects not only the respiratory tract, but sometimes it will involve and damage other organs also. So the manifestations will not only be the respiratory problems, but sometimes it can involve other organ systems of our body also and cause different manifestations. But why this virus is not recognized by all of us for a long time? Because it was causing only a mild subtle infection. That is why not much of importance was given to this. But all of a sudden, this has caused a pandemic, which has caused a lot of life loss, damages, economic loss, etc. And now we are now in the focus of this coronavirus. And before this pandemic, if we see even in the year 2002 and in 2004, this has caused severe infection in the China, which is now considered to be the site of origin of this present pandemic. It has also caused the infection in the year 2012 in the Middle East, and also now we are facing the existing now pandemic problem. So coronavirus in short is a respiratory virus which causes respiratory infection. Of the coronaviruses, there are many kinds of viruses. We are concerned with the coronavirus one, which causes the common cold. Apart from that, there are other viruses which are subtypes identified from these viruses. They are called as MERS-CoV. That is the Middle East Respiratory Syndrome, which caused the coronavirus infection in the Middle East countries. Similarly, there is another virus called as the SARS. SARS means it is called as Severe Acute Respiratory Syndrome. So it is a Severe Acute Respiratory Syndrome. It's a type of, once again, the coronavirus. In the year 2019 in China, this virus has caused a very atypical infection. So normally I told you before, this respiratory infection caused by this coronavirus goes unnoticed. It comes for the stays for 2-3 days, and it is most often self-limiting. That is why we are not aware of all this infection and the name. But in the year 2019 in China, it caused a very atypical infection, which was very contagious, which was causing a lot of organ damage and ending up in life loss. That is why it is called as novel. There is something different. That is why they label this as novel coronavirus. and it is once again a type of this SARS, that is the severe acute respiratory syndrome type of coronavirus, and it is called as SARS-CoV-2. That is why it is labeled as SARS-CoV-2, or otherwise called COVID-19 infection. COVID means the CO stands for corona, the VI stands for virus, and D for the disease. So it is coronavirus disease. That is why it is shortly called as COVID. And it started in the year 2019. Then it is called as COVID-19 infection. So this is just an introduction for all of us to know why it is called as COVID-19. What is meant by COVID. Then why it is called corona? How come this name has come for a virus by name corona? See, if you see the shape of this virus, the coronavirus under the electron microscope, this is how this looks like. You can see there are projections standing on the surface of this a ball-like structure, which resembles that of a crown. You can see in olden days the kings are used to have the crown, and there will be projection spikes made up of ornaments and all those things. So like this. So that is why it is called as coronavirus. How come then this name corona? In Latin, the word crown is called as coronum. That is why it is called as coronavirus. So this is how this virus has got its name. So with this brief introduction, let us know how this virus causes damage and destruction to our body and why it is very troublesome. If you see, this virus enters our body. Once it enters the body, it gets attached to the respiratory lining epithelial cells. Then it slowly penetrates and goes inside the cell. Then it multiplies, matures, and then it gets released and causes damage to our organ system. So this is how this virus causes the problem to us. This not only causes damage to the respiratory tract, sometimes the virus will spread to other organs and it will cause damage there also, and the manifestations will vary. Nowadays, this coronavirus 19, which is causing almost destruction and damage to almost all the organs of our body. You see, sometimes the brain will be affected, sometimes the intestine will be affected, sometimes kidney, apart from the common problem of lung issues. There are many mechanisms how this causes. Sometimes it causes the blood to go for clotting, then the blood flow to particular organ may be reduced at cellular level and causes organ damage, or sometimes it can cause what is called as inflammatory response, wherein when our body starts to react with the virus or starts fighting with the virus to neutralize it, so there are some chemicals which are released in our body system. These chemicals are detrimental not only to the viruses but sometimes to our own body system. So that can also cause organ damage. But still, we are not able to have a single medicine which can completely destroy this virus and completely protect our body from this destruction caused by these viruses. And still, there are about 2 to 3% of death rate possible with these severe infections caused by these viruses. So this is picture once again says the same thing what I was telling. So it enters the respiratory tract, then it goes attaches to the epithelial cells there and gets imbibed into the cells inside. Then the virus will attach its RNA material into our system cells. Then our cells will multiply and make more viruses. Then these viruses gets released from the cell. Then it affects our organs, and when there is a reaction happening between the virus and our white blood cells, so there are a lot of chemical mediators which are released, and they causes a lot of side effects, starting from the fever to slowly respiratory distress and organ damage, etc. So if you see how these organs are getting damaged, as I was telling you beforehand, so there are many mechanisms like damage to the small blood vessels, and then causing a small blood clot formation called as the thrombi, or occlusion of the blood vessels, and then leading on to the organ dysfunctions, and it can cause a lot of damage at the cellular level in the lung called as the alveolar damage or the pneumonia, which will prevent the oxygen exchange. When there is no oxygen exchange happening in the lungs, all the body system will face the reduced oxygen blood flow condition called as the hypoxia. Then the cells will not be able to metabolize and they will not give the energy needed for our body system. Then each and every organ will slowly becoming weak and they will not start functioning. Then they will deteriorate and end up in life loss. So this is the mechanism how this virus causes the damage. Then what is mean by this wave? So we are now telling something called as third wave. First of all, let us know what is this wave. Wave means It's a term used to say the rising and the declining trends of the number of infections that happen over a period of time in a particular place. For example, if there is a jaundice infection happening in one place and it is contagious and spreading through water or other mechanisms to one group of people in over a place, then the number will initially be less, then it will slowly rise, then it will come down. So this waveform is made like a curve. So this is what they call it as wave. So there should be a sudden rise in the number, then the ascending link followed by the downtrend of the disease. So this is what is called as the wave, and is often referred to a country or a state. So that is why epidemiologically they refer this wave pattern to describe that particular disease is spreading in this manner, and then how it is rising and all those things. If you look back at our history, so the Spanish flu, which was spread at about in the year 1918 and lasted for about 2 to 3 years. So this is the curve pattern. You can see initially started slowly, then it has gone for a big, affecting a lot of people, then it is coming down. Then after a break, there may be an involvement of other little amount of people. So this is a curve pattern of some of the diseases which spread rapidly happened in the past. When you come back at the COVID, so the scenario that is possible with this disease is it is yet to be completely predicted, and then we have to come to a conclusion. But from the experience of this, the wave 1 and 2, when you look at the wave 1, which was relatively milder form, and then it affected comparatively less number of patients. But the wave 2, which is supposed to be less dangerous, but it affected more number of people and caused more death worldwide. And still, the prediction is going on whether it will come down and then touch the normal, or whether it will go for another third or fourth or something like that. So that we have to wait and watch and then see what's going to happen. So the third wave currently which is under discussion is the possible surge of these cases at our national level in other countries. So yes, definitely there are cases that are happening after this second wave also. There are some places where there is reporting of more number of cases coming out. This may be due to the different variant of this COVID virus called as the Delta variant, which is originated from our country and spread to some of the countries also. And this is a severe type of variant of the virus, because the virus has got a nature to change from one character to another, so that it will escape from our immune mechanism. Even if you have got the virus infection by a previous strain or the subtype, next time if the virus comes, that may not be the same. So your white blood cells or the immune system may not be able to recognize that virus and immediately neutralize the virus. So the virus will go and once again can cause the infection by escaping from this immunity mechanism, and that can cause infection in more number of patients also. And if you look at the picture, this the second wave, the Delta variant constituted about 60% of the patients, and the third wave is definitely is going to happen, but the timing when it's going to affect and how many are going to be affected is yet to be known. But our WHO, the World Health Organization, has already announced that the third wave is already existing and it has arrived in many of the countries. And they predict in India it may be possible in the month of September and October. So the next 2 to 3 months is going to be very crucial. So we are already on track for this third wave, and the second wave itself has not come down and reached the baseline. Still, there are patients who are getting affected by these viruses. Of course, in pockets, in places, in some of the states, including Kerala, Tamil Nadu, etc., it's there. So it's happening. So the disease has not come down to the normal or a standstill. So it is definitely happening. And if you look at this Delta variant, it is a very fast spreading and very fittest virus, because this virus is not like the previous strain. So this is affecting people and spreading very fast. If you look at previously the wave 1, if one patient is infected, this person can spread maximum to 1 or 2 persons only. But this Delta variant is causing spread. That is the reproductive figure, what we call it in the virus. So that is going to be very more for this virus, and it's able to infect large number of people in a shorter time. That is why in the second wave, if one person in the family is affected, almost all of them become infected very shortly. So we have to be very careful with this virus. And if this third wave is being caused once again by this Delta variant, definitely it is going to be very fast spreading, and more number of people may be involved. And our WHO says yes, our country is also being the at least it's going to get involved because of the more number of population. And another important thing which we have to remember is these viruses, they don't believe in mathematics. See, if we say that one virus can infect from a person to another or two maximum like that, but it doesn't behave like that. The number suddenly increases very rapidly, and the number of patients who from the hospital becomes multiplied like anything. So it doesn't follow any strict rule that only this much number of patients has to be infected by this particular number of infected persons, something like that. Because this virus is like something one is very deeply trapped. We don't know where he will walk and where he will talk. Like that, the virus also behaves like that. They spread from one place to another, and because of the rapid transportation system and all those things, it can spread from one place to another very fast. It can involve very a large number of people in a very short time. But we are trying to predict based on these calculations and models that how many people will be affected and how far is the severity of this wave. But definitely, if you look at the peoples in our country and the number of people who are already vaccinated and infected, the number who are very vulnerable or prone for infection are more than who are already infected or who are already immunized. And even if the people who are immunized, they may not get the infection, but if they start traveling from one place to another, they may carry the virus and transmit to other people, especially the children in our home or something. And if you look at the present scenario, there are definitely warning signs, and there are many places worldwide which are getting involved by this wave of coronavirus infection once again. And even in our country, there are many cases being reported in many places, and the numbers are sometimes more than what it was before. And even in China, in Wuhan, they now started screening all the residents, because there also there is no surge of cases happening there. And there are many news channels and TVs and then newspaper bulletins, everything giving that there are increase in these numbers, and definitely we have to expect the third wave, and we have to be prepared for that. And what about this children condition in this third wave? Are they going to be infected too much, or only the children is going to get involved in this third wave? So let us discuss about that. If you look at the disease severity, so in children also, the COVID virus infection has got a wide spectrum of manifestation. Some may be asymptomatic. They may not have fever or anything, just they will be only carrying the virus. So if you do any COVID screening test, they may come positive. Or they may develop very mild symptoms like fever, cough, cold, myalgia, body pain, like that, etc. Or they may be moderate, whom may not need a hospital admission, but the symptoms are more, so they may need more amount of supportive care. Or they may be very severe or critical, needing an intensive care unit care, and their oxygen level may fall down, and they can have organ dysfunction, all those things, etc. So it is a wide spectrum of disease, like the same thing what happened in adults also. But one thing we have to remember is, if you see the number of people who are getting the severe disease or the critical type of infection, it has been found that in infants, that is the children who are more less than 1 year of age, are more vulnerable for severe type of infections. And children, they may not develop a very severe type of infection. Thus, I'm talking about those that are between 5 years to 15 years or so, because they don't have pre-existing other organ dysfunctions. They don't have other comorbidity conditions like hypertension, diabetes, or cancer, something like that. So they may not get very severe symptoms. But in case of infants, they are very prone to get severe type of infections. But if you look into the number of children who are getting infected, And the population of this pediatric age group, that is less than 15 years, they constitute about 20 to 25% of our whole country population. So if you look at the number, if the number is very dramatically high, and the number of children of which who are getting a severe infection may be statistically very significant, and the number may be more. So that we have to keep it in mind. And the number of children who will get admitted for our inpatient care, from our previous observation, it has been found that it's relatively less than the adult. For example, about only 15% of children may need hospital admission when you compare with about adults, where it is about 15 to 35% of adults needed a hospital admission and inpatient care. But in case of infants, up to 60% may need admission because they have got a very small airway, so their lung capacity may be very poor, and they may not tolerate even a short duration of reduced oxygen content in the body. So they may need very increased need for intensive care unit in case of children. And another important fact we have to accept is children are as susceptible as adults. What we thought from the first wave and the second wave, we all thought that the children are less prone for infection. They have very less number of some receptors in the respiratory tract. That is why they are not getting infected. But it is not the case. They are as equally prone as that of adults for these COVID infections, because the manifestation and the number of testings done on children may be less, but the disease involvement is possible in all children like that of adult. That we have to remember. And another thing is there is no COVID vaccine for children as of now. So in some countries they are given for children from 12 years onwards, but less than 12 years they are not tried, and the trials are still going on. So in our country, only those they are more than 18 years are eligible to get this COVID vaccine as of now. So they are not yet vaccinated, so definitely they are very prone for infection. And another thing is, even if they are getting infected, so as I told you, in case of children, those they are more than 1 year of age, the mild and moderate disease may be there in more cases. But if the number of children who are infected are going to be in large number, and if the severely infected patients are getting admitted, then that number may be significantly high in the hospital setup, because our hospital setup, country may not be able to give the care for all these severely infected children if it happens in a very short period of time. So that also we have to keep it in mind. And this few percentage of children who are getting involved in this severe form of disease are prone to develop a condition called as multi-system inflammatory syndrome in children. That is what is medically labeled as MIS-C. That is what multi-system inflammatory response syndrome. So that means when the reaction happens between the virus and our body white blood cells. So literally it is a fight. The fight is happening between the two. So during that reaction, there will be a side effect. There will be a lot of release of chemical mediators from our body system. These chemical mediators not only try to neutralize the virus, but it also causes damage to our organ system. So the organs that are commonly disturbed by these chemicals which are released, called the cytokines and interleukins and all those things, which we call medically. So the organs include the lung, kidney, heart, brain, etc. So mostly all organs are prone to get involved by this multi-system organ inflammatory syndrome in children. So that we have to keep it in mind. So they are prone for that condition also, which is a described entity similarly in case of adults also. So as I told you before, and it's going to be a wide spectrum of disease. So from starting from asymptomatic to severely ill children, and only about 1% of children will get a very serious disease, whereas in case of adults, about 5 to 6% become very serious and they need intensive care and ventilator support and all. But from the previous experience, and the projection is maybe only around 1 or 2% of children only will get this severe disease, but because of the large number of pediatric population, even this 1 to 2% is going to be a very significant number when you look at by and large at the society level and as well as in the hospital setup level. So the number is going to be very significant if they are getting involved. But the good thing is they don't have comorbidities or other disease involving the other organs, but that doesn't mean that they are very immune for involvement by the COVID disease. Another important thing is treating a child is not like that of an adult. They are not small adults. See, we cannot give, for example, if you are giving a tablet, one tablet for an adult, we just cannot make it into half tablet or one fourth of a tablet and give it to a child, assuming that the child is half the adult or something. They are entirely different. Their physiology is different. Their behavior is different. Their metabolism in the body is different. Okay, so there is going to be tricky for treating this small children, and we need specialized centers and specialized team of doctors and nurses to treat this children. And another thing is they don't communicate. They will not tell us what problem they have. So it is the duty of the medical team and paramedical team to identify what problem they are undergoing, and provided the parents they bring us to in time, and then to identify and what state they are and then treat accordingly. So there is no communication from their side that what is the problem or issue what they are facing, and they are at high risk for hospital admission when even compared with adult. So the number of children who will need hospital admission may be more than that of an adult, and carrying them is going to be once again a challenge. Another issue is simultaneous presence of other viruses in the lung of children, since they are very prone for respiratory infection quite often. So there can be other viruses which live in the lung, which can have a detrimental effect because of associated infection, or sometimes it can even prevent them from getting into the severe type of virus. So both are possible, but it is very difficult to predict whether other infections will cause issues or anything. But a secondary bacterial infection following any viral infection in the respiratory tract is going to have a severe a bacteria-induced pneumonia changes and destructions in case of children. Another thing is there is a thin line between a stable child and a sick child. Adults may take few days for them to deteriorate and become sick, whereas in case of children, they may be doing well in the morning. Suddenly in the afternoon, they will be very sick, because so their organ systems are stable in the initial phase, and they can suddenly collapse, and the margin between the stable point and then the sick region is very thin in case of children. So that also you have to keep in mind. And the infrastructures and the hospital facility available for young children in our own country is relatively less when compared with the population. So that also you have to keep in mind. So if the number happens like that, the second wave, it is going to be very difficult task for the whole medical fraternity in the whole country. So, but if the number is also going to be more, the relative number of severe cases are also going to be significantly high. So this is once again the same, but if you look at the past experience, the pandemic normally lasted for 2 to 3 years in most of the infections. If you consider that, still we have got another year to go in this. This is more than a year or so. So we have to be very prepared for this, and the pandemic is not yet over, and it will be only declared only by the WHO that when the infection is almost ceased and it's an end point when it is not causing. A long way to go. So we have to be prepared for all those things. So how this is going to be the third wave? If you ask me this question, even the experts feel it is very difficult to predict. So they feel two types of possibilities can happen. So if you look at, so either they can they become completely immunized and they may not become infective further, or there can be a sudden increase in the number of cases, and they can involve large number of patients and involve the group. So the third wave may not be as severe as the second wave, but the possibility of a new variant, which is the character of the virus, can cause more infection. So we have to be very prepared and we should not lower our guard. But only thing is the vaccination can protect us from severe disease, even if the strains changes their character and come with a new infective foci. So at least it can prevent us from the severe infection. That is a good thing about the vaccine. So the carry home message is COVID-21 is definitely going to happen, and it is different from that of COVID-19. The second wave has virtually infected all the members of the family. So similarly, if the same thing happens, the COVID, which is going to happen, the third wave can also involve large number of victims. From the first wave, we all thought that it will not infect children because the many theories which have been postulated are they have less number of receptors for the virus to get infected in the respiratory tract, and they don't have organ dysfunction, all those things. But in the second wave, we have found that all the children are also equally prone that of adults. But only thing is, many of them they have not got a severe disease and they are not brought to the hospital setup. That is one good thing. But the other side of that is the children are not yet vaccinated, so they are very prone for infection. So once they get a chance to get exposed for these viruses, definitely they will get infected. That is the big issue for us. So the third wave is already happening, so we need not wait for that when it will happen or something like that, because there are places and there are many reports saying that the numbers already started to increase in some of the places. But only thing is how far the community is infected and how far the community is vaccinated and how far we follow the norms to prevent the infections of this COVID is only the thing which is going to uh, consider as a criteria to say how many number are going to get infected and when the third we will have. That is the only things. So on hearing all these things, even every parent will get into a panic state because everybody will be feared about their allowed young kid. So how are we going to reduce the third wave? What steps we can take to prevent the third wave? So let us see those things in our few slides. One thing we have to remember is already the kids are suffering a lot of mental challenge. See, they have been not sent to school for last 1.5 years. Initial days they felt very happy. Later they felt okay. Now they are feeling very fed up with the house online classes and all those things. So now they want to go to school, but the scenario is not allowing them to go to schools. They have a lot of mental challenges because of that. So we have to understand that also and keep it in mind when deal with the children. The first and foremost thing is we should not get panic about this. We have to be confident. We have to follow the scientific evidence how to prevent this disease and how to prevent this third wave. So all those things, first of all, we should be understanding those things, and we are the role models for them. If we follow the physical distance and if we wear the mask, they are also going to follow the same. And if we insist them on doing the proper hand washing and using sanitizers, everything, definitely they are also going to follow, and that is going to help us to reduce the third wave involvement in the public level. It is very important to maintain the physical distance and you stay home as much as possible. You work from the home, which is a very good option. So only if needed you have to go to the office. And whenever you go outside, it's better to wear a N95 mask, which only will give you protection. So a simple cloth mask or mask with valves and all has been found that they are not that much effective in giving protection for the COVID infections. And it's better always avoid the public gatherings. So whenever it is possible, we have to avoid, because that is the only way we can reduce the chance of infection. Or sometimes you may go and you may be already vaccinated or infected, so you may not get the infection, but you'll carry the virus home and give it to children, so they may get the symptomatic disease and they will get into trouble. So that we have to keep in mind. And we have to always discuss what is called as the COVID appropriate behavior, called shortly as CAB, with the children, and we demonstrate them. For example, how to wear the mask, how to keep up the physical distance, and how to wash their hand, and how to apply this hand sanitizers, all those things. So we have to teach them, we have to demonstrate them, and then make them prepared for using the mask, etc. So the ABCD to be followed by parents are be always available with them, explain them what it is, and be tactful, be polite in explaining them. You don't have to be harsh because they're already psychologically very upset, and you should be always calm and reassuring them. And you don't get panic even if somebody in the family gets positive. I will discuss in next few slides what to do when that is the scenario, and be an example for them by following all these CAB protocols. So only useful thing is you wear a mask, you make them to wear a mask and maintain social distancing, and then you take vaccination. Only these three things are going to protect us from the COVID infection as well as the third wave. That is very important. We have to insist the children that they should wash their hands after using the bathroom and they sneeze or before it. That is very important. And as I told already, you should restrict yourself from going to public gathering, and you have to restrict them, the kids also, to going for outdoor games with a lot of crowd. So encourage them to only to undergo only indoor games or within the house to do some exercise or physical fitness things, etc. When to send them to school? It's a big question mark. Nobody has got the answer for that. So only when most of the community is vaccinated and if there is no any new infections happening, then only that is feasible. So we have to wait long way for that. So you have to show images like this to them also. So even if they go to school in near future, we have to teach them how to wear the mask, and we have to make them accustomed to wear the mask, and then how to maintain the social distance during the classrooms and outside in the playground, etc. And then when they come back, they should wash their hand properly. That is very important thing. Like that, so we have to teach them and then make them prepared and be ready for them in the near future, so that when schools open, they'll follow the COVID appropriate behavior protocols. Another important thing is you should not panic, you should not rush and overstock things. There is one important thing which predisposes all of us to get infected. So going for places or shopping malls or anything, saying that there is going to be a lockdown, we have to stop this much like this. That is the time when everybody gets exposed from close contact with others who are asymptomatic or who are infected, and then get into the trouble of infection or carrying the infection forward. That is one thing which happens during this overcrowding that happens when any lockdown is introduced. So we have to plan accordingly, because the government is taking appropriate steps to balance both. So you have to follow that only. You should not unnecessarily overcrowd also. That is one thing we have to keep it in mind. Suppose if any of the family member gets positive, so what to do? So if the family member gets positive, first thing is you have to separate them, and then when to test our child. So that is also one thing which you have to understand. Suppose when to test a child is if the family member is positive and if your kid is in close contact with them, then we have to consider doing a test. Or if the child develops symptoms of COVID, then we have to. Or if there is a persisting fever beyond 3 days, then it is indicated to do a COVID test in the children. Otherwise, it is not necessary. And what to do if any one of the family member is positive? First thing is don't get panic. First thing is don't get panic, and you have to isolate the person who is infected, and you have to shift the child also to another room or to another house or some relative house or somebody who can definitely take care of the baby if possible. And we have to instruct the person who is taking care of the baby to look for certain things. If the baby is getting any fever, and if the fever is for more than 3 days, how severe it is, whether baby is crying or lethargic, that we have to look into. And if there is a chest indrawing or any discoloration of the baby, whether they become pale or blue color or something like that, and if their peripheries, the hand and the feet are turning very cold, but they have fever in the night time or something like that, there is a reduced urine output, and if you have these small pulse oximeters, if you check the oxygen saturation and if it is less than 93%, so these are the red signals which will warrant us to bring the child immediately for hospital setup. So that we have to look for, and we have to always make a teleconsultation or a personal visit to the pediatrician to show your child if the fever is there at least for 3 days, or if there is a history exposing them to COVID positive people. That is very important. So in nutshell, in the carry home message, what we got is, so the third wave is going to happen. It's already happening, but it can be avoided or reduced in severity only by following the CAB, COVID appropriate behavior. The second wave has taught us to be cautious rather than to be hopeful that this is going to be very mild. So everybody normally in the from the past experience, the first wave is going to be larger than the second wave, then it's slowly tapered. But in this COVID, the first was relatively small one. Of course, it caused severe destruction, but still, when you compare to the second wave, it was small. But the second wave was very furious and caused a lot of damage and destruction to the economy and life worldwide. So we have to be very cautious. We don't know how this third wave is going to be behaved. So we have to wait and watch. Another thing we have to remember is the children are as prone as adults, and some of them they need hospital admission, and the infants are more prone to get admitted. So we have to be very careful in children who are less than 1 year of age. Vaccination is very safe, effective, and it is a game-changing tool. So every one of us should take vaccine without any hesitation, because that is definitely giving protection from severe disease, protection from the infection. That is the only tool to reduce the chance of infection spread among the community and reduce the severity of this third wave. And never ever self-treat your child, because it's very difficult. They will not communicate, and we will not be able to pick up the severity unless you have got a medical experience. So it is difficult to treat a child. So never do that, because if you come in the last stage, as I told you before, and there is only a thin line between the normal child and a sick child. And if you bring the child in a sick state, it's very difficult, and they will go into ventilators immediately. And if they get the MIS, that is the multi-organ infection syndrome in children, then they are going to get into big trouble. And there is no evidence that this third wave is going to affect only children. Many thought that it is going to affect only for especially children. It is not the case. It's going to affect adult also, but children also. The children are prone because they are not yet vaccinated. That is the only thing. And if they get infected, so there is a chance for them to get into severe type of disease also, like that of adult. So we should be prepared for the worst. There is no harm in preparing and keeping ready for this third wave. And the only way is to once again to wear mask, maintain the physical distance, vaccination, and follow the safety protocols. Thank you very much, and I will be very pleased to answer any of the questions. Thank you so much.
Thank you, Doctor. I will open the floor for Q&A.
Yeah, please.
I have unmuted all of you, and now you can unmute from your end and ask any question. Alternatively, you can use the chat option to type in your questions, and one of us can read that out. Okay, so there are two questions now. First question is, hello sir, would like to know why the vaccination process is restricted for children, since they are more vulnerable to virus. Already in developed nations, they are providing the same for children.
See, the vaccines which are prepared and given to our population is based on the clinical trials and observations. The initial study was done in only adults, and the safety precautions and the feasibility studies are done only in adults. There are some vaccines which are being studied and found to be effective and safe in children more than 12 years of age. And that is why it is been given only in children more than 12 years of age. There are studies undergoing to consider the vaccination for children below 12 years. So in shortly we will be getting vaccines which can be given in younger children.
Okay, thank you. And yeah, I think you answered the second question along with it. Will there be vaccination for children in future?
Definitely it's going to come. So shortly it will be introduced.
One more question. What are the side effects of vaccinations?
See, if you see any vaccine, so any vaccine, if it is given, and if vaccine most often is either the dead form or live attenuated, that means it is in a state, it is not in a state to cause severe infection, or sometimes the chemicals we call it as toxides that are secreted by that particular bacteria or virus. So these are the three forms we introduce that into our body system. Once that is introduced, then our body will recognize that some foreign material is coming into our body. That we call it as antigen. So anything, any virus or bacteria or any chemical, whatever goes into our body white blood cells will recognize this is something new to our body. Then they will start reacting. Then they start what is called as immune reaction. They start producing what is called as antibody, which is nothing but a protein that is secreted by the white blood cells. Or sometimes they make themselves what is called as natural killer cells or killer cells. These are the cells are like a policeman. They will go and attack somebody who is like a thief and catch hold of it. Like that, this killer cells are also made. So this is, we call it as cell-mediated immunity. So these are the two mechanisms. One is by producing the protein called as antibody. Another one is making what is called as killer cells. So these are the two mechanisms by which our body gets prepared to protect from this particular disease. By introducing a vaccine into our body gets prepared for the future attack by this particular bacteria, virus, or something like that. So this is the concept of any vaccination. So when we introduce any foreign material or anything, definitely there is going to be some type of reaction. The body will start reacting for that. So for that, the white blood cells will work more. So there will be some amount of a little bit of body pain and fever, and all those things happens, and local discomfort at the mild pain at the site of infection. These three things are going to happen in any type of vaccination. There are some complications related to some of these vaccinations also, depending upon, for example, the protein or the material, the background material which is used to prepare the vaccine, or the preservative that is there in the things. So they are also going to cause little bit of complications. Apart from that, the final thing is there are special complications which can happen with certain vaccinations, depending upon what type of vaccination it is. If it is going to be a live attenuated vaccine, so that concerned virus is relatively in a, active form, but only if you give in that stage, it will induce the immunity in the body system. So those vaccines are going to cause little bit of more reaction, or even like a even mild type of that particular disease which is going to happen. So that is why we get a little bit of reactions. And the storage proteins are the medium which is used for preparing this vaccination sometimes can cause what is called anaphylaxis. That means, for example, some persons who are already exposed to a particular protein, for example, let it be A, and if they come across next time with the same protein into the body, sometimes would have been an antibody formed already for this protein, thinking that that is different protein from their body. When we give the same medicine or the same vaccination the second time or something like that, then the reaction may be more, because this protein which is there in the vaccination beforehand was recognized as a foreign protein or something different by the body system. So they will start reacting too much, and they may get a fall in blood pressure and fall in the heart rate, something like that. We call it medically as anaphylaxis. Those things can happen in a very relatively less number of people. That is there in any vaccine, not only in this COVID vaccine. But by and large, if you see, the amount of protection and the benefit that is given by a vaccine is vaccine where outweighs these mild type of complications or the issues that happen in any vaccination. Then only the vaccines will be accepted for administration.
Thank you.
You got my point, sir? Yeah.
Yes, yes. We have one more question from Surabhi. What are the symptoms of Delta variant?
The symptoms of Delta variant are not different from any other variant. When you look at the symptomatology, it starts with the respiratory infection with fever, body pain, aches, and then loss of smell, appetite, all those things. They are all going to be same. And all these three symptoms or four symptoms can happen in other virus which causes respiratory infections also. There is no any separate disease or symptom manifestation for this variant. But the only thing is this variant is prone to escape from the immune mechanism that is developed from the person from the previous infection, number one. Number two, this has been found to cause relatively a faster rate of organ dysfunctions, and more number of patients needed inpatient care. So that is the only thing. And when you look at the age group of the people who are involved by this, in the second wave, even younger population of 30 years, 40 years are also more involved than the first wave. In the first wave, the lot of people who have died because of this COVID are found to be more than 50 years of age. But in the second wave, even younger age groups have been affected. But we cannot directly blame all those things only for this Delta variant. But the Delta variant has caused almost 60 to 70% of the infection during this second wave. The variants are going to have definitely a little bit of differences in the symptomatology as well as the severity of organ involvement, but it will be around 70 to 80% is definitely same that of a parent virus. Not much different, but definitely there will be a mild difference. If you exactly look into the figure, the Delta variant has caused more infective rate. That is what we call as the reproductive quotient. Suppose if one person is infected by one strain, when compared with the Delta variant has infected more number of persons from that particular patient one. So the infectivity is more. That is nothing but the spreading ability, and the disease severity is also a little bit different from that of the other variant.
Thank you, doctor. And
Yeah.
from the, I mean, once you take the first dose of vaccine, how long does it
Yeah.
take you to get that protection from the virus? And also, it says that
Normally, any viral,
after the first dose and second dose, um, for 2 weeks, you will be more vulnerable for the infection. Can you clarify on that?
we are not more vulnerable, we are equally vulnerable. The vaccine, once any vaccine is taken, normally it takes 2 to 3 weeks for our body to first recognize that some a virus or a foreign protein is introduced into our body. So the vaccine says you may prepare yourself by producing the antibody or the killer cells to kill it in future when the real virus comes. So for this, it takes about 2 to 3 weeks for our body to ourselves get acute to deal with the onset of infection that is being caused by the virus or the bacteria per se. So any vaccination will take about 2 to 3 weeks at least to prepare ourselves. During this 2 to 3 weeks time, we are not more prone to get infection. We are equally prone. Even if you are not got the vaccination, you are going to get infected. Means that is there. That infection is there. But after the vaccine is effective in your body and it's stimulated your body system, then definitely it is going to give protection. But all vaccines will not stimulate everyone's immune system to give 100% protection. That is there. That is not only in this COVID vaccine. Other vaccines also, it is only about 70 or 80, depending upon the what type of virus and what type of vaccine it is and how many number of times we give it and all those things.
Is the 2 to 3 weeks window applicable for the second dose also, or is it only for the first dose?
No, it is for the first dose because in the first dose only we are getting exposed for the virus or the vaccine for the first time. And after the second dose is given like a booster dose. We should not make our immune system to forget the mechanism or the type of the protein what it has to produce to kill that particular virus when it comes. So just we are using the second dose like a booster dose to stimulate further and create more number of what is called as memory cells in our body to remember this and then keep the immunity lasting for a longer duration. For that purpose only we give the second or third doses. There are some viral infections we have give about 3 doses of vaccine. For example, there is a virus called as hepatitis B, which causes jaundice. So we give it as 0. For example, if we give the vaccine today, and then the second vaccine will be given after 1 month, and the third dose will be given after 6 months. It is called 016. So we give only after this first dose, about 60 to 70% of the immunity will come. But if you give the second dose and the third dose, you will be definitely will be protected for at least for next 5 to 10 years of age. So like that only we calculate and then do studies and then we make a protocol which way and then what is the duration and number of times you have to give that particular vaccine so that it will be effective in more number of people and it will be effective for a longer period. So if you take at least one vaccine, definitely at least 60 to 70% of the people are going to develop antibodies, and you will be protected for a shorter duration. But if you take the second dose, more number of people will be protected, and the duration of the protection will be longer. Only for that benefit you have to take.
Okay, thank you, Doctor.
Yeah.
Will there be booster dose of vaccine in the coming year?
That question is still going on among the all virologists and the vaccine manufacturers, and we have to see, because they are conducting zero surveillance. They are conducting the antibody titer in individuals after this vaccination of two vaccine or one vaccine, and how long they are going to stay. So only thing is the time is the answer. We should be able to predict that better, maybe in a shorter duration of 6 months to 1 year from now. All these vaccine protocols for the many diseases which are already been accepted had already undergone a lot of clinical trials and changes. After that only we start following that. So like that revisions may happen in this COVID vaccination also. As of now, we are using 2 doses. So there may be a need. Suppose if you want to prolong further, or if very new strain comes, so they may include that particular strain of virus, and they may give a new vaccine also. So there are other viral infections called as the flu. The flu virus is there, no, which causes the respiratory infection once again. So those vaccines are reintroduced every 6 months, 1 year, something like that, depending upon the new variant which come in the past. So they will retrieve that virus and then make a new vaccine and then introduce into the vaccination sector, so that will be introduced to prevent the further infection, like that.
So next question: vaccination, give different side effect. It shows different side effects on different people. Some does not have any side effects or symptoms after the. I'm sorry, that's not the side effect. It is the symptom after the vaccination. Some people get mild symptoms and some get severe symptoms.
Yes.
So can you explain on this, and is it
Yeah.
related to the immunity levels of the people?
Yeah, the variation is determined by our individual's body mechanism. See, for example, some people, they will not get allergy for dust. They may be even sitting on the road. They may be inhaling all the dust the whole day, but they will not get any dust allergy or something like that. It is because their body is not reacting unnecessarily to the dust particles. But a person who is sitting in an air-conditioned room with all the windows closed, even with a mask, sometimes they will get allergic airway disease because of the dust allergy. It is because their individual body nature is different. Their body detects something is new to them, and they start reacting and start producing this allergic reaction. Similarly, if this vaccine is given, so for some people the vaccine will go and then just only tune the immune mechanism and stimulate only the immunity and keep them prepared and ready to tackle the infection in the future. This is what we wanted, and this is what everybody wants. But without our knowledge, our immune cells, that is the white blood cells, sometimes will overreact to the vaccine. They may think this is something new protein which is not related to us, and they will start reacting too much. So, and they will develop more symptoms like local discomfort is too much, the pain is too much, the fever is much, and sometimes they'll get joint pain, and sometimes they'll get the regional lymph node enlargement also. Those things are possible in some children, some patients. So that is decided entirely by the body makeup, and which is not in our control. So our own genetic makeup and our own immune system will decide how they react with this vaccine protein, and that depends on the individual body makeup, what for they're exposed from their fetal life onwards, depends on their body individual character to react for that any exogenous material. So it's highly unpredictable.
Okay, thank you, Doctor.
Yeah.
So if there is any other question from anybody, you can quickly type in or unmute yourself and ask question. Otherwise, we will wind up.
Is the discussion useful for all of you?
Definitely, Doctor. It was a wonderful session. It was very informative. So thank you so much for the session.
See, medical details of disease. So I just want to give a bird's eye view without going much into the medical details, so that but we have to understand what is this corona, why it is called so, and how this causes our organ destruction. So it can cause varied range of symptomatology from asymptomatic nature to severe disease. The same thing is possible in children also. So we have to be prepared, and I think we have to still continue our COVID appropriate behavior to curb this third wave. Yeah.
So let's wind up. Thank you so much, and it was a
Thanks for
wonderful
all
session.
this executive and everyone. Thank you so much.
Thank you.